al doctor Andrés de Francisco, que va a darnos la bienvenida y una introducción al webinar. Gracias.
Muchas gracias, Oriel. Buenos días, buenas tardes, buenas noches a todos y a todas, dependiendo de donde estén en este momento. Mi nombre es Andrés de Francisco, soy el director del Departamento de Familia, Promoción de la Salud y Curso de Vida de la Organización Panamericana de la Salud. En nombre de la OPS, les doy una gran bienvenida a este seminario. Este es el primero de 3 seminarios de una serie llamada ¿Cómo lograr que la evaluación sea un elemento clave para abordar las inequidades y los determinantes sociales? Durante esta serie de seminarios nos vamos a centrar en la importancia y la necesidad de la evaluación de nuestras actividades, de nuestros programas, planes y políticas. Y creemos que es un punto muy importante para realmente darle la calidad a la evaluación. Pero a esto se agrega también el tener en el centro la equidad en la evaluación, lo que implica considerar un papel que jueguen los determinantes sociales en nuestros resultados. Para ello, estos 3 seminarios nos darán un marco general de la perspectiva de la evaluación, conocida como la evaluación realista o evaluación desde la teoría, en que nos orientará sobre la importancia de los contextos, las condiciones sociales, los grupos objetivos en el diseño e implementación de nuestras intervenciones. El próximo webinar se titulará Teoría, Mediciones y Análisis centrados en abordar las inequidades, y el último webinar será sobre cuándo utilizar la evaluación y cómo usar sus resultados. Estos seminarios forman parte de la iniciativa especial sobre los determinantes sociales que está desarrollado por la Unidad de Promoción de Salud y Determinantes Sociales de mi departamento, que está comandado por la doctora Theyre Heterogeneous, esta unidad, a través de la cooperación suiza por los próximos 8 años hasta el 2028. Esta iniciativa está en su etapa de instalación o inicio en 5 países de esta región, que son Colombia, Costa Rica, Chile, Perú y El Salvador. Y una de sus líneas de acción será fortalecer las competencias en la evaluación en equidad y desde esta perspectiva. Esta serie de webinar están siendo coordinadas por Sanjeev Sidrahan, quien está presente. El profesor Sanjeev, lo voy a introducir, es el director fundador del Centro de Evaluación de Intervenciones en Salud Complejas de la Universidad de Toronto y líder en sistemas de aprendizaje y evaluación de sistemas en la oficina de país en la India de la Fundación Bill y Melinda Gates. El profesor Sanjeev ha liderado proyectos de evaluación complejas en China, Estados Unidos, Canadá, Chile, Escocia, India y Sri Lanka. Es un honor que él nos va a acompañar en los próximos 3 webinars y además en esta línea de trabajo que desarrollaremos en los próximos años en relación al proyecto regional de los determinantes sociales. Dejo entonces al profesor Sanjeev para que nos presente los panelistas y nos introduzca el tema, y les agradezco a todos y a todas por estar presente en este y los siguientes 2 webinarios para que podamos escuchar, aprender e implementar lo que aprendamos dentro de nuestros programas para implementar intervenciones con el centro en equidad y el papel que juegan los determinantes sociales. Muchísimas gracias. Profesor Sanjeev, tiene usted la palabra.
Thank you, Andres. Really a pleasure to be here. Oriel, if you don't mind coming on video for a second. I just want to say that today and the next few months is a journey that started almost 12 years ago in Chile, where we began asking How do we rethink the role of evaluation? And how can we move from an evaluation that focuses on effectiveness towards more deeply and in a non-mechanical way, ask questions around inequities? So Oriel, Antia, and Gonzalo we've been discussing this almost on a weekly basis in the last couple of months. And all of this is culminating towards actually trying to bring some more energy on how we move towards a much more real view on how do we create interventions, how do we develop interventions that can actually impact inequities. So Oriel, thank you for your initiative. I'm delighted today to be joined by two of my very, very dear colleagues, Abhijit Das from the Center for Health and Social Justice in India, in Delhi, and also from the community of practitioners in accountability and social action in health. He's also in the core group in the government of India's, he has been in the Human Rights Commission, the focus on health. Abhijit has been a dear friend for the last 15 years, and he has pioneered, in my view, the applications of evaluation that incorporates context in real settings in India. Accompanying Abhijit Das is Dr. Mel Mark from Penn State University, who's been my mentor. I came into evaluation because I was influenced by Mel. Mel has been a leader in theory-driven evaluation and mixed methods evaluation. Mel has been a former editor of the American Journal of Evaluation, a former president of the American Evaluation Association. I think it is important for us as Oriel and a team in PAHO, as we start trying to develop a field and we try to sort of not just have cool webinars, but actually contribute in a very real way in rethinking the role of evaluation for inequities. I was just sort of really delighted to have both Abhijit and Mel join us in this journey. It'll be lovely to hear from you, and as the dialogue proceeds, please do include your questions in the chat, and I'll sort of at the end we'll come back to the questions. The way it's structured is I'm going to spend the next 22 minutes on laying down a vision for how this field can go. It's about 20. That'll take us till about 12:05 Eastern time. Then over to Abhijit for about 10 minutes and Mel for another 10 minutes. That takes us to about 12:30. That'll leave us about 30 minutes for discussion, I'm saying Eastern time. So let me get started. Let me sort of share this. Can somebody give me permission to share the screen, please?
Yes, you have it.
It says somebody else is sharing. I'm not sure who else is sharing. Can somebody check? I'm looking at it. The message says you cannot start screen share while other participant is sharing. Something is going on. It says, Fernando, you're sharing computer sound.
Sorry, can you try it right now?
I got it. It's working now. Terrific. Super. Slideshow. Okay, so I think let me start by sort of saying that we really need to, there's a view of evaluation that's far too mechanical. And I think part of today's session is to start a journey where we start rethinking the role of evaluation, or definition of evaluation itself. So part of the 3 webinars has 3 goals. One is I'm going to argue evaluations matter centrally for all our interventions, whether we're focused on SDGs, whether we're focused on a local community intervention. We need to be locating evaluations quite centrally into addressing inequities. In a few weeks from now, 3 weeks from now, November 18th, we'll ask, that's all great, but tell us how to do it. So that's going to be quite central. The third one is, it's one thing to produce good information, good evidence. The question is, how is any of this actually used? We learn from different practitioners and I like this idea of an ecology of evidence. There's never just one piece of information rarely suffices to bring about change. How can we build such an ecology? That's the central problem. So for today, I'll introduce some ideas for the next 20 minutes, 3-4 minutes, but I want you to think about your own interventions, whether it's in PAHO, whether it's in a UN organization, whether it's a Gates Foundation or a community organization. what makes it challenging? What makes the actual implementation of your intervention challenging? I'm also going to connect it to ideas of complexity, but also connect it to the larger SDG movement itself. Three, quite central, is I'm going to tell you 3 quick stories on my own sort of philosophy or some experiences I've learned, including one with the WHO, that'll help you understand that why we need a slightly different view of evaluation. The fourth is then on to Abhijit and Mel, who Trish could not attend because she's away in, she's had an internet problem in Congo. Where we are going today, and we'll end hopefully this in the discussion, to start laying a framework on how to go about doing evaluations. That's not the focus of today. That's a focus for a session 3 weeks from now. All right, so give me 1 second. So the kind of traditional view of evaluation is linked to performance. It's a means of assessing performance and to identify alternative ways to deliver. I'm going to argue, actually, that's not good enough. For the work we do in implementing interventions and locating evaluations in that space, we need a view of evaluation that can actually help us navigate the intervention itself, almost in real times. It's not just about performance. So we are wanting a more dynamic view of evaluation as we go forward. So I want you to take a step back and ask yourself, based on the evaluations you've done, what has been the purpose of evaluation? Generally, evaluations fall into these 3 or 4 categories, these 4 categories. In one case, you're just asking questions about, does your intervention work? Thumbs up or thumbs down? Well, you're really asking summative questions. And that's where RCTs, experimental trials, a whole bunch of design questions come along. A second kind of question you could be asking is, does this intervention need a little bit of improvement? That's a much more formative goal. A third is you want to study. You were supposed to have implemented the following 3 things. Was it actually done on time? You're asking questions around oversight and compliance. What I want you to focus on, though, is knowledge development. But I want to sort of argue, actually, for many of our interventions, the state of evidence, the state of knowledge is often not that deep. We'll actually have to build the knowledge as we go along. And so I'm going to argue evaluations itself provides a knowledge development goal. So just to locate these examples, let's locate this sort of ideas through an example. So it's an example from Scotland, almost from 15 years ago. But the focus was on reducing health inequities related to cardiac disease. And the way the Scottish government did it, as a number of your interventions did, was they tried to reach the most disadvantaged populations that were not using the system. Once they came into the system, they offered risk screening, health coaching, a bunch of other interventions itself, in the hope that once they reached the poorest people, and if they came through the system, that would lead to a reduction in heart disease. Notice the fact that if they were unsuccessful in reaching the most disadvantaged folks, and the folks who were already better off were coming through the system, chances are you might improve the overall health, but you're not going to lead to a reduction in health inequalities. Keep that example in mind. We'll come back to this. But this example also lays the framework for what I want you to think is the different purpose of evaluation. Sometimes as an evaluator, you're simply asking, is this a good intervention? And think of it like drinking soup. Sometimes you're the restaurant critic. You go to a restaurant and your job is to say, is this a good soup in the restaurant? Thumbs up or thumbs down. And the next day in a local paper, you'll write, don't go to this restaurant, the soup is not good enough, etc., etc. That's a summative goal. A second goal, a second purpose of evaluation is much more formative, where think of yourself as a friendly spouse who comes home, you have the soup, your spouse asks you, your partner asks you, is the soup good or not so good, and does it need something? You say actually it needs a little more salt, but you're trying to improve the soup a little bit. That's a formative purpose of evaluation. In the past, most focus on evaluations have been both summative and formative. Just remember what this implies is that you've actually tried the soup before. Now, the problem with complexity is in many, many cases, no one's actually made the soup before. You're trying complex interventions where you actually have to make the soup as you go along. You have to develop it. The evaluator's role in such a is to actually help the people making the soup make a tastier soup. So you're actually developing the intervention. What I'm going to submit to you, that number of our interventions actually fall in that category of a much more developmental goal. And we've got to help develop the intervention as we go along. So, all right, that sets the framework for what I want. My goal for the first section was simply to get you to think about different evaluations have different purposes. And in the inequity story, we'll have to be quite nimble. We'll have to think of different purposes of evaluation. So let me go back to Have a Heart, Paisley, a story that I've just told you about in terms of screening, health coaching, reaching. I was based in 2007 in Edinburgh, Scotland, where the story takes place. 6 months into the implementation, the project director calls me up in Edinburgh and says, actually, after spending a lot of resources, the intervention is not going well. We did our best to reach the poorest people, the most disadvantaged, but we are unable to reach them. What should we do? Now, at that time, what we were doing was a fairly traditional evaluation design, where we said, actually, the nature of this design is you have to let the experiment run. You cannot be changing the intervention mid-course, et cetera, et cetera. So sitting in Edinburgh, my position was, no. You cannot be suddenly changing what you had promised to do, et cetera, et cetera. Now, looking back, my answer was completely unsatisfactory. In reality, what the project director was doing was completely the nature of how most of our interventions actually work when we implement. Surprises happen. Our best laid plans don't work. You have to adapt. And the important part is you cannot let the research or the evaluation direct what should be a kind of commonsensical approach to programming. I was wrong and she was right. So part of what I want to stress here is for our complex interventions, adaptations matter. We cannot say this is the protocol. That's fine for you're testing a drug, but for some of our complex interventions where the world itself is quite open, quite complex, and our knowledge is limited, we have to go beyond protocols and experiments. 3, every intervention has its own life. There are dynamics here, there are surprises along the way, and part of our job as evaluators is to be open to it. And finally, it's a point I cannot stress strongly enough, even in the best cases of evidence-based interventions, we have tremendous incompleteness right at the outset itself. That's one story. Second, from Scotland, we go to Toronto, a beautiful intervention called Dancing with Parkinsons. The focus here was to use dance to make a difference in the lives of Parkinson's patients. And for me, after almost 30 years in this field, this is among the most exciting interventions I've evaluated. The interesting thing was when we started the evaluation, I have a couple of colleagues here on the call who were part of the evaluation. We thought what was the main active ingredient of the intervention was either the dance or the music, which is all the music itself was live. To our surprise, when we began analyzing the evaluation and analyzing the data, what was clear was, this is Sarah Robichaud, the founder of this rather amazing intervention. What we realized, what Sarah had managed to do was to build a massive network of people interested in this intervention. And she had almost as many volunteers as she had participants. And this was important when you teach dancing with Parkinson's, you need people to take care of the clients, almost a one-on-one. So she built a volunteer network that was really intense. And that's what allowed her, because there were lots of volunteers, allowed her to deliver this intervention at a fairly inexpensive rate, $10 a class or something, reasonably affordable. Now, around this time, a national agency comes along and they say, we want to scale up this intervention all across Ontario, all across Canada. And they asked our advice, should it be scaled up? Our view was not yet, because it's not a mechanical thing. It's not as though you can go out and teach 500 classes all across Canada. But you've got to build those community networks, et cetera, et cetera. So it's not that easy to scale it up. So all of this is to say, when you think of an intervention, you've got to think about the different support structures that might matter. It's not just about the dance, not just about the music. The volunteers may not be as exciting when you write up reports, but they matter too. Go back to your own intervention, you'll realize a lot of other things that matter. 2, you have to ask yourself, what is it about this intervention that brings about the change? What's the mechanism? In this case, it was relationships. People loved Sarah, people loved the volunteers. It was not just about the dance. You could do the dance at home if you wanted. Maybe unsafe, but point was these mechanisms matter. We've got to ask those kinds of questions. 3, part of Sarah's class was there different students in the class, all with different levels of different intensities of Parkinson's. Her own strength was delivering different interventions for different people. It was a heterogeneous interventions for different people. Different people were getting different interventions. She could do that because she had a good volunteer network to support her. It was not a one-person show. 4th, very critical, and at the Gates Foundation, we struggle with these issues. How do you know you have enough information to scale up? Before you scale up, you have to ask, what is it that actually makes this intervention succeed? Often, it's not the music or the dance, it's these smaller things like the volunteers, etc. 3rd story, that's closer to home for PAHO. This is from Delhi. This is from 2013 or 2014. There were large efforts happening to get different WHO nodes to rethink their strategies for addressing health inequities in India. Now remember, this is a question I know PAHO deals with a lot. But when you ask yourself, does WHO have the leverage to impact health inequities in India? You realize at best WHO can contribute to some changes in health inequities. They cannot make a dent by themselves. So it was a very interesting structure. Some of it really came out of Oriel's thinking, where over 3 days, different nodes come up with a plan to address health inequities. And there were five or six different nodes. Each node came up with a different plan. And on the Friday afternoon, different nodes presented how they plan to impact health equities. And there was a leader from WHO who responded to these ideas. Now, most of the plans had a structure of the following. We will collaborate, WHO will collaborate with this Ministry of Health, with this state ministry, with this, et cetera, and as a result of such collaborations, we hope to make a difference on inequities. Now, the person who spoke was one of the best discussions I've ever heard. He said, I hope you know, he starts off his discussion by saying, I hope you know I'm your friend. And as a friend, I hope I can be honest with you. I found every one of your presentations very superficial, was his response. And he said, let me tell you a story. It's a story of the elephant and the mice. Turns out the elephant and the mice are good friends, and the mice goes up to the elephant. And he says, do you mind if we go for a walk? And the elephant says, I'm a good friend, let's go for a walk. And they start walking. Then the mice turns to the elephant and says, actually, it's not so exciting. Do you mind if you go for a run? If you start running? So the mice runs in the front, the elephant runs behind him. And as the mice is running, he looks back and he turns to the elephant and he looks at all the dust that's being created. He turns to the elephant and he says, can you believe the amount of dust we have created? With a focus on we. So this gentleman sort of tells the story, and it's a remarkable story. It's important because when we collaborate with state organizations, with government, it's important to realize that there's a power issue here. It's also important to realize that there's an elephant and there's a mice. And the person ends this presentation by saying, don't you ever forget in all your theories of change that in most cases, I work at BMGF and Bill and Melinda Gates Foundation. But it's really important for us to realize in a country as complex, any country, but certainly a country as complex as India, even the largest development organization is the mice. The elephant is the government or the community organizations. In most of our thinking of our intervention, that's something Oriel has written a lot about, issues of power have not been considered. It's really critical as we ask ourselves questions around health equities. Just remember, our own leverage to impact health equities is limited. We can contribute as organizations, as development organizations, but it's people who are locally based who need to run with it. So we can help be catalysts to build capacities, but it's a more contribution problem. You cannot attribute it to this itself. So this also helps the stage to say the challenge of addressing inequities is a hard one. And this is where we have to, that's why terms of thinking about intersectoral action, thinking about complexity becomes absolutely critical. All right, so let's go deeper into health equities, and this is from the famous 2008 report, where they argue that, and this is really your bread and butter at PAHO, this idea are avoidable. Health inequities are avoidable, or a toxic combination of poor social policies and programs, unfair economic arrangements, and bad politics. Now, I like this quote because it also tells you how difficult it is to actually change this through well-planned intervention. It tells you the kind of scope of the problem that you're up against. I like this slide because it also talks to you about, I'm really setting the stage for, as we start thinking about inequities, I want us to imagine the most disadvantaged individuals, folks who fall in the multiple intersections of problems. And this is from a UNDP report, but they say you've got to consider geography, discrimination, shocks and fragility, governance, socioeconomic status, etc. So what I want us to think about is, how does our intervention reach the very people who need it the most? And what are layers and what are ways in getting to that? And how can evaluation help us guide this? So I'm going to take this, and not everybody agrees, but I like this idea of thinking, at least, even though in the operationalization it could be harder. This idea of leaving no one behind, which is the focus of SDGs, where they say the agenda is the SDGs. As we embark on this journey, we pledge that no one will be left behind. We endeavor to reach the furthest behind first. So the evaluation challenge is, how do we move from rhetoric? How do we move from plain empty speeches towards there is substance in such a claim? And part of locating evaluation is thinking of ways in which evaluation can play a navigation role in actually making this a reality. So I'll take a step back and I'll sort of say, actually, no, this is great. Now we've laid out the landscape. Now let's think through the nature of our interventions. Very rarely in the community health space, in maternal health, et cetera, do we have interventions that don't change. Our interventions are often changing, if not constantly changing. Feedback matters. This is why you want to build an MLE systems, et cetera, learning systems, et cetera. I want you to pay attention to the last bullet. And this is where I think both in the planning and the evaluation, we don't consider it. Often there's a reason why the problems of inequities exist. We've got to pay attention to how the system itself, this notion of policy resistance, the tendency for the intervention to be defeated by the system's response to the intervention itself. In my own thinking, working at the Gates Foundation, I'm increasingly asking not just policy resistance when the intervention is being implemented, but what happens when the funding stops? We need to link these ideas to sustainability. I like the slide. The slide comes out of Ray Posson, who I think might attend in the next couple of sessions. But he argues this is an important slide, every one of your interventions includes has a theoretical idea. It is a theory. It says, if I do A, B, and C, D, E, and F are going to happen. Your theory might be utterly wrong. 2, every one of your intervention fundamentally depends on people, on the actions of people. If people don't understand what you're saying, et cetera, there's a problem. I won't go through all these points, but be aware we're dealing with dynamic interventions that are prone to modification. In fact, that's exactly what learning means. So what I want you to think about as you think about your own intervention, they are dynamic, they're heterogeneous. An intervention implemented in Valparaiso might look very, very different from an intervention implemented in Lima. How do we better understand the context that shaped these interventions? Third, very rarely in the space we work in, there's just one component. There are multiple components that are interacting over time. These interactions itself will change over time. So as I wrap up, as we try to locate the role of evaluation, as we move towards specifics, let's go back to have a heart-based data. Let's think about the reach problem, the screening problem, the health coaching problem. Let's just worry about the reach problem. What is evaluation's role? Evaluation's role is not just to say that this reach worked or did not work. It has to help build real-time knowledge on how can reach for these kinds of initiatives in this kind of community can actually work. There's an evaluation. You're also synthesizing information from the literature. And as a result of this evaluation, you come up with a better program that leads towards a richer view of reach, a richer view of screening, a richer view of health coaching. I want you to sort of realize the traditional view of evaluation. There's a program, you hire the evaluator that tells you, does it work or doesn't work? I don't think that's good enough for addressing inequities, because that lacks humility, that lacks modesty, that lacks an awareness that our knowledge is pretty incomplete at the outset. What we need is a view of evaluation that can answer what the initial impacts as the program started, but can also build knowledge of these were things we were uncertain about. We didn't have our model of reach correct. And you learn from it and you build a better program as you go forward. So I also want to, in the next 2 or 3 minutes before I turn it over to Abhijit, ask you to think about what kinds of knowledge do you need from the evaluation? What kinds of knowledge can it generate that can help you address inequities? I would argue you need some knowledge, not just about the program, but is the policy space itself conducive for the implementation of this program? Sometimes you might implement a program, a wonderful program, but the policy space is completely hampers and actually is hostile to that itself. You've got to sort of think about that. Every program, every intervention is a complex system thrust into other complex systems. You've got to ask yourself, what's the level of organization needed to implement this program? Guess what? In more cases than not, our levels of organizational knowledge is very limited. Process. Often we pretend to know more about what works in terms of process than we actually do. So an evaluation can shed light on what kinds of models of health coaching works, doesn't work, etc. The fourth is especially important. We actually don't know enough about our clients whom we are intending to serve. Evaluation can itself develop knowledge that you needed to know to make such a difference. Of course, there's a whole bunch of impact knowledge that can follow. Okay, so to sum up, as we locate evaluation, there's a broader policy space that says, actually, PAHO, can you help us with thinking about Bill and Melinda Gates? Can you help us think about addressing problems of maternal health inequities in Uttar Pradesh and India? There's a policy landscape. The game we normally play is we'll use evidence, we'll have some theory, we'll create some program. And then we hire an evaluator. And often the evaluator's job is to, you think in the way we teach in academia is to sort of collect the data. But actually the evaluator's job often has to spend time developing a theory of how could this intervention itself work. Bring some focus on areas that are uncertain, sort of promote dialogue, etc. The evaluation itself can generate different kinds of learnings that I've just talked about. But it's really important that our job does not stop there. You have to align that learning back to the policy space, back to the program space, so that as a result of all this, you're starting an influence process that can make such a difference. So that's sort of, all of this then leads to action. That's sort of the background to these dialogues. Next time, in 3 weeks from now, we'll sort of talk about the how. But now I want to turn to Abhijit first and then Mel, folks who have worked very, very deeply in this space, in Abhijit's case, in the health equity space, in Mel's space, thinking about how can we actually have a more fluid approach to Mel. So Abhijit, over to you for the next 10 minutes. I'll just stop sharing, sorry.
Yeah. Thank you. Thank you, Sanjeev. And thank you all from PAHO organizers. I'm deeply indebted to you for giving me this opportunity to share some of my experiences. Let me now share my. Yeah. Can you see my screen? Yeah. So as Sanjeev has said, most of my work is around health equity and around social determinants. But I have a sort of confession to make. I am not an evaluation expert. I'm a doctor by my first training, and later I was trained in public health. So probably many of you at WHO and PAHO have a similar background. At the same time, I'm a cis male person, I'm heterosexual, but I'm interested in equity. So I'm a man, heterosexual, interested in equity, which creates a particular sort of confluence of interests. I started work as a community-based doctor and obstetrician, later worked on reproductive health, community participation and governance on one side, and gender equality and masculinity on the other side. I moved away from working at the community level and became more interested in designing and implementing programs, monitoring programs, and sort of advocacy in the public policy space. So very clearly, my interest was in program, in data, in its impact, but I was not seeing myself as an evaluation person. Now, to come to the issue of social determinants, these are definitions from the WHO itself, so you are very familiar. These are non-medical factors which influence health, and they are conditions about the social context, the background, the systems in which people live, grow, sort of spend their lives. And there are systems which are economic systems, which are social systems, which are policies, development agenda, etc. And equity is not only differences, but it is unfair and those which are avoidable and remedial. So I think these are key things that I have sort of pinned upon as I develop, as I said, theory and practice. This also, I'm sure you're very familiar. For me, the area of interest has been the box in the center, the egg-shaped, which talks about class, gender, ethnicity, social cohesion, social capital, material circumstances, behaviors, psychosocial factors, and interaction with health systems. So this has been the area that I have been interested in. Now, in simpler terms, I've seen these as how do biological factors interact with social differences and the health system to create, in very public health terms, differences in incidence, prevalence, treatment, responses, and outcomes. But how did we see it? And I want to share some experiences from my work in Maharashtra. Sanjeev has also been seen that work, he's evaluated that work. It was with men in the community. Core intervention was around violence against women. It was looking at gender as the key area of interest, gender inequality. But what we saw and what we intended was not only to have outcomes in the domain of violence against women, which was the primary interest of UNFPA, who were the supporters of that program, but also areas around maternal health, contraceptives, which I felt that since UNFPA was supporting it, why don't we look at it? And then we had a whole series of other outcomes, which I'll come to a little later. So in operational terms, and this is extremely important, for me, social determinants of health is nothing but people and their relationships. And how to affect health-related behavior. So people and their relationships. It's not only the person whose health we want to change, but all the people around him or her, people in the family, people in the community, people in the health system, people in the governance system, etc. The second, which I feel is operationally important, is what is the program theory? And program theory is how much do we know about these relationships and how they affect the domain that we are interested in. And the second more important thing is, what is our anticipation about the impact of the program intervention on these relationships? So for example, if we want to talk about contraceptives, and we are going to do contraceptive education and provide contraceptive sort of material, contraceptive let's say condoms or pills, how much do we know about how people exist within spousal relationships? How much do we know about respect and affection? How much do we think our material supply, our health education will actually influence that relationship between the sexual relationship, the intimacy relationship, the affection relationship between the spouses, and the usage of the product that we're talking about? How much do we know about it? Second is, when we're talking of outcomes, let's take the example of contraceptives. Most of the time we are interested in contraceptive prevalence rate, which we can call the maternal. But do we have any speculation about the relationship-related outcome? Contraception is going to take place within a spousal relationship. It is going to take place within a relationship which has certain power dynamics. It is going to take place within a relationship where there are expectations of the mother-in-law, there are expectations of the larger family. What do we know about them, and how do we expect this to change when the contraceptive prevalence rate has increased, let's say, from 25 to 45? And then we have the health-related behaviors related outcome. And let us say, if you're talking about something like maternal health and the use of institutional delivery services, which has been a matter of intense policy interest in India, is why do people go to a hospital or don't go to a hospital? Why do a particular provider or don't go to a particular provider? Why should that behavior change? What is their belief system about childbirth? Childbirth is not just a biomedical event. Childbirth often is a cultural event. There are a whole range of belief systems around childbirth. In India, we have 12% or so indigenous population. We have 25% or so people who belong to backward classes. Now, these people have health belief systems which have emerged from the social, economic, and the healthcare related reality in which they survive. Oftentimes, they don't have sufficient belief around what we call modern medical systems. Why should it change? What is our anticipation about the change about those behaviors? Now to come to more practical examples. As I said earlier, a program theory is our anticipation of how the relationships will change, and social determinants is about relationships. So the various people who are involved in this process are the person involved. And when we talk of the person, issues of self-concept, issues of expectations, issues of levels of obligation. Each relationship has a level of obligation and also a level of prior experience. When we talk about the family, there are differences which are related to gender and age. When we talk of the community and relationships with the community, within the community, in a country as complex as India, class, caste, religion, ethnicity, race, place of living, the rural or urban, which part of the country do you live in, all of these matter in each relationship. When we talk about the public system, oftentimes there is an assumption that whatever is written in public policy will be followed. However, within public policy, there are issues of client-patron expectations. There are expectations around rent seeking. Corruption is a big issue in public systems in India. And then there is this issue of governmentality. Governmentality is completely different from policy inscription. It is an idea of how public systems maintain their positions of power, maintain their positions of stasis in many ways, despite the policy inscription asking them to do something else. And then there are the issues related to health system, differential knowledge levels around the health problem. There are the whole range of health-related beliefs around different kinds of health problems. And importantly is the level of distress or the level of need. Oftentimes, like let's say for vaccination hesitancy, the need is of the systems. People often don't feel that they need to take preventive action. So people's level of need and health systems anticipation of what people should be doing be completely different. However, in extremely opposite situation, when there is extreme pain, people may be in high levels of distress and willing to go to a certain extent to get relief, whereas the same thing may not be how the provider looks at it, because the provider may feel it's a very, very minor problem. And all of these interact in what I am calling the black box of complexity. As we design our program, we have to understand what those relationships and outcomes are, relationships and movement towards outcomes. And the second is what kind of intervention makes a movement in what direction. And this is where I'm talking about assessing the change process. When we are dealing with such a complex situation, we need to have a process which informs us as this complex process starts rolling. We program implementers will have program interventions. Those program interventions are designed with certain expectation of change. What is the expectation of change? The expectation of change can broadly be called how will the different stakeholders react to these interventions. But as each of the direct stakeholder reacts, there are indirect effects. Interaction between the program intervention and the person's behavior because of the program intervention. What is our anticipation of these effects? Are we understand how these interventions happen, how they affect the relationship towards the direction of change that we wish? Oftentimes, we assume that because we make an intervention, things will happen the way we want. Within a system where relationships have power within them, which Sanjeev has mentioned, one of the things that we have noticed is what I'm calling the patronage effect. The patronage effect is the person in positions of power does not mind the person who is oppressed getting some benefits. But once the person who is in the subordinate position starts challenging the power of the person who is in the higher position within a social hierarchy, there is pushback. Have we anticipated pushback? Are we trying to pick up when pushback starts? Because if pushback happens and we have not anticipated it, their program may start rolling back, and which leads us to stability of change. We are often very satisfied when the first signs of change show, and which could be due to the patronage effect. But we want sustainable development, that is SDGs. So SDG anticipates stability. What do we know? How do we try to understand that stability of change? And coming to health outcome, oftentimes we are only concerned with the material change that we were interested in. Are we also setting up a set of outcomes in our indicators about the new health-related behaviors that we expect will sustain the material health change that we are looking for? Are we setting up indicators for the new relationships which will emerge because our program has now reached a stage of stable change? Until and unless we are constantly interrogating these, how do we know that the complex box that I talked about is actually showing processes which are moving in the direction of change? And this can be with simple things like tuberculosis treatment. It can be with a little more complex things as maternal health and especially emergency obstetric care, because there are many, many more stakeholders in that game, or something like contraceptive delivery, which is located within the domain of sexual and reproductive health, which is extremely complex and determined by complex cultural and social factors. So my point is, how do we as program implementers, that's where I come from, how do we understand that change? How do we monitor that change so that we know that the inequity that we want to address is changing in the direction of equity, which means social relationships have now changed. The hierarchies are now a little more equal. And the fact is that health outcomes are accompanied by a form of social justice. Thank you, Sanjeev.
Abhijit, thanks so much. I want to reiterate 3 points. Working with Abhijit, he doesn't implement an intervention until he deeply understands the context. He actually builds, I loved your focus on actually building expectations of what changes the world for different segments. That requires inner knowledge. You actually require field knowledge. Too many of our interventions are not built on such contextual knowledge. 2, I like your way unpacking black box of complexity, and it's something Oriel and me and Antia and Gonzalo have talked about. I think we need to move away from just a language of complexity, a language of context, towards being more specific about the nature of subsidies. That's 2. 3, I'd like to call out to governmentality. I think too often in our interventions, we are too enamored of our intervention, knowing fully well it can be totally ignored. A system that is quite happy doing its own thing is not suddenly going to change just because you think you've got profound wisdom. I think those are important things to incorporate as we think about design. Mel, Mark, over to you for your thoughts on how to take this dialogue forward.
Thank you. I am not going to share screen. I will introduce myself, will add to my introduction by saying that I'm a social psychologist by training. And as I was thinking about comments, something that came to mind was a classic piece of advice from the literature on attitude and persuasion, and it is know your audience. And I have to admit that I don't know you all as an audience well, so I hope you'll show forbearance with this outsider. But as I've listened to the past two presentations, I realized perhaps I should have thought more about knowing my fellow panelists. So many of the remarks I anticipated making have been made before by the two previous presenters, which brings to mind there's an article I read years ago about faculty meetings. And for those of you who have not gone to faculty meetings, I'm sure you've spent many meetings through the week. There's an expression describing how some people approach meetings that everything's been said, but I haven't said it. And I'm afraid I may be taking that position here in the sense that my remarks will echo much of what you've heard. I'll mention a kind of an overarching theme of my comments, and it is a term that Sanjeev used quite a bit, and it's heterogeneity. And I'm going to talk about heterogeneity not only in terms of the varied ways that people may respond to a given intervention, but also to talk about heterogeneity with respect to evaluation itself. Sanjeev had a slide up that referred to 4 possible purposes of evaluation. One of them, merit and worth, is often referred to in terms of summative evaluation, trying to draw a bottom line judgment that might guide decisions about program continuation or expansion or dissemination or replacement, often accompanied by methods like RCTs, contribution analysis, outcome tracking of various kinds. And he mentioned program improvement, some often referred to as formative evaluation, which can take a number of approaches, some smaller, some larger. Some might be trying to look at ways of improving the entire theory of action underlying a program. Others might be looking at smaller pieces, such as the reach of a program or the way that participants are brought into and encouraged to receive an intervention, but looking at program improvement. Thinking about these and other possible purposes of evaluation is important because there still are some organizations that have a kind of one-size-fits-all, a kind of here's how we do evaluation or here's what evaluation is. And given the complexities that Abhijit and Sanjeev both mentioned, we need to have evaluation that is heterogeneous with respect to its purposes and the methods that are used. The third purpose that I'll talk about, which was also on this slide Sanjeev had, of kind of knowledge development, or more generally one might say learning, is something he emphasized, and I will as well. And as he pointed out, there's a variety of different kinds of learnings that can occur. One that is often of interest to evaluators is how and why change occurs if it does. And if change doesn't occur, if, for example, health inequities are not reduced, what are the obstacles to that? And under what conditions are those health equity reduced? I'll mention that in a moment, but keeping in mind these 3 different purposes of evaluation, a kind of summative, formative, and learning kind of function, I think can be valuable in avoiding a one-size-fits-all and in meeting the particular needs and opportunities that might be present, and meeting the kind of level of knowledge that we have. So to be clear, I'm not advocating heterogeneity of evaluation just for the sake of heterogeneity, but to try to get a better fit of evaluation activities to the circumstances at hand. And I would argue that being multilingual with evaluation theories, models, approaches, methods is an important way of doing that, an important part of doing that. This notion of the broad array of evaluation options is also important. Sanjeev mentioned the term ecology of evidence, which I think is a very important concept. As a subpart of that, we might think about the ecology of evaluation. So what different kinds of evaluations are undertaken by which different players in a complex system, where you have a supranational organization, there are national actors, there are local actors. What aspects of evaluation are done, are supported at various levels, and how are those brought together towards a picture of collectively employing evaluation in service of reducing health inequities. The reason to think about knowledge development, learning, as a key purpose for evaluation in this domain is something that, again, both of the prior presenters addressed, and it is the limited degree of knowledge that we have about how to go about bringing that change. Among the things where it makes sense to be heterogeneous, I'll mention a couple that are not. One I'll mention now where it doesn't make sense to have a great deal of heterogeneity is with respect to our humility, our acknowledgement about the limits of what we know. That I think was a key comment from Abhijit. That there are undoubtedly heterogeneities in the response to an intervention. Those can arise for a variety of reasons. Among those are heterogeneity of implementation, heterogeneity across individuals in the degree of severity of the pre-existing determinants of ill health, heterogeneity across individuals with respect to other personal characteristics or dispositions, or with respect to situational factors that influence response to an intervention. The complexity that people mentioned is key. Understanding the heterogeneity of responses to an intervention is one approach to building better interventions, to being more successful, to identifying, people talk about theories of change. There's a variety of approaches to that. The quality of those with respect to the substantial challenge of reducing health inequities is not where we want it to be. So a question is, how do we get it better? And one of those is to think about examining heterogeneity in responses. Many times evaluation, especially the kind of traditional approach that Sanjeev had as the top option among two, very often that traditional approach to evaluation acts as though there is a hypothesis to be tested, that a particular intervention will have particular beneficial consequences with respect to reducing health inequities. And it's treated as though it were a hypothesis in a bench science where we collect data to test the accuracy of that hypothesis. And that's well and good, and that has a role, but even within the same kind of evaluation exercise, there can be heterogeneity with respect to methods. The kind of bottom-up examination, the more inductive or exploratory kinds of looks at where the program was more successful, where it was less successful, what kinds of circumstances seem to facilitate outcome, but the desired outcomes versus not. The learning, there are ways of trying to peek into that black box. And I think sometimes we use the term complexity almost as a get out of jail free card, as though we say we're dealing with complex systems, and that has implications for how we evaluate, but we need to be more specific about the forms of complexity. Sanjeev mentioned the metaphor of soup around different evaluation purposes. You know, formative when you're the cook and you taste the soup to decide whether to change things. Summative when your guests taste the soup and decide if it's good. He mentioned developmental, which is a bit more open-ended perhaps, and he mentioned where you don't know the recipe. Added to that is the complexity. There are likely to be different recipes. There are likely to be different pathways to the achievement of reducing health inequities. That's not something we're going to learn from a traditional approach to evaluation alone. That's not something you learn from top-down kinds of hypothesis testing, because we don't know enough at this point about what those different pathways, those different recipes for soup are likely to be. Sanjeev mentioned trying to have time for discussion. I want to be respectful of your plans and of the plans for your time and the plans for the session. A couple of things in closing. One other place where we should not have heterogeneity is with respect to recognizing the importance of the kind of work that you're doing, that your organization is doing, that your collaborators in multiple countries are doing. That's something that we presumably should agree with. I would hope we would also agree that attention to heterogeneity, both in the kinds of evaluation that we do and in terms of more intensive study of the heterogeneous responses to interventions, is worth having in our portfolio. And with that, I will say thank you again.
Mel, thanks a lot. Before I open it up for questions, I've got a question for you, Mel, and a question for you, Abhijit. Mel, everything that's been described by you, by Abhijit and me, what stands out is that's not how we train evaluators. There's a big gap between the training of evaluators and the reality of especially addressing inequities. Part of the dialogue that Oriel, Gonzalo, Antia, PAHO group and we are discussing is how do we actually think about training of evaluators for inequity space? Anything that comes to mind, I'll give you 30 more seconds. I will also pose the question that I'm going to ask Abhijit to do. Abhijit, again, now that I work as a funder, as a Gates Foundation, again, I'm sorry to say I've not been able to implement enlightened models of commissioning evaluations. I'm perpetuating the slightly mechanical view of evaluation for a range of reasons, including my lack of creativity. My question to you is, are there positive suggestions you can make, Abhijit, that will lead us towards a much better model of commissioning evaluations that could be helpful to PAHO and WHO and other folks who are there today? But Mel, why don't you take it away with a quick 1-minute reflection on my question?
One of the challenges, I think, is very often we ask people to teach evaluation who are specialists in methods.
Right.
And that leads to a kind of reification of existing methods and traditional ways of doing things. You've used the phrase, Sanjeev, that you have to love your problem. You have to love your problem more.
Right.
Starting with the problem and the challenges of the problem and acknowledgement of the limits of the conceptual frameworks that exist to be applied to the problem might be one way of trying to help. We probably also need more examples of doing it different ways. I'll pause.
Lovely. Abhijit, quick 1-minute response.
One of the things that, being at the implementer end of a donor and evaluator relationship, I've often felt a sort of collusion of interest between implementer and the evaluator. Because when things work, everybody feels that their work is validated and vindicated. And the issue of learning is not important. Because funding depends on success of the implementation and tied with the success of a very limited range of indicators, the objective of learning falls on the way. And unfortunately, we do not incentivize the learning process, even if the learning is that things didn't work because we did not take these into considerations. And to make things work, probably we now need to do it differently. So the follow-up project is a different project, but looking at the same overall problem. What we do is when it fails, the funding is independent.
Abhijit, we are losing Abhijit.
Evaluate a relationship. Hello.
Yeah.
So this relationship between the implementer, the donor, and the evaluator has to be a much more open-ended learning intervention. And if we acknowledge complexity, then we cannot have 2-year, 3-year program cycles. Doesn't work.
Right. Oriel, any quick reactions first, and then I'll open it up more broadly, but I also would like Jerry and Anders to come into it if they want to. Oriel, any quick thoughts from your side? Oriel?
Yeah, I am here. Well, I put something that, no, I think this is very interesting, and maybe some of the questions that many times the people ask is how the evaluation include or consider the heterogeneity of the population, no? Because sometimes the program many times is very homogeneous for the total the population, and not necessarily is specific for the need that the group has, no? And what do you think about the evaluation for this perspective include the heterogeneity of the population and the context that you say in the beginning, that is crucial for the process, no?
Mel, quick 30-second reflection. Abhijit, 30 seconds. I'll add 10 seconds at the end. Go ahead.
So I hope this is responsive, even in programs that are targeted towards some group that's supposed to be high in need. There's variability with respect to need. There's variability with respect to the array of characteristics that Abhijit mentioned. Exploration after the fact is one valuable way to supplement evaluation in the kinds that it's in the way that it's being done now. Other kinds of approaches, going to Abhijit's comment about funding cycles and this kind of crazy way in which decisions are made about implementing a new intervention after one that's failed. If we could do more along the way of small step kinds of building of interventions that might be respectful of heterogeneity, that might go a long way as well. Thanks.
30 seconds.
So for me, I think we often look at heterogeneity as being different kinds of colors. A diversity of colors, like race and ethnicity, is often expressed as categories. The point is, within a race, there is a relationship. Similarly, if somebody is living in the Amazons and somebody is living in the urban city and somebody is living in the favela, just taking the example of Brazil a little bit, I know, is that those are not just places where they live. They also think about each other in a particular way. So I think when we are talking about complexity and heterogeneity, we have to locate it within power of relationships. It cannot be treated as categories. And oftentimes we simply treat heterogeneity as differing need. But it's not just differing need. It's a question of that need emerges because of certain circumstances, and Group A and Group B relate differently in a situation if they come together. And then there is competing resources.
Fred Carden, you've been a champion in your work on thinking about, so much of Abhijit's point is about taking relationships seriously. Fred, do you have a quick 30-second reflection on how evaluations can be much more serious about studying relationships, not just outcomes? Fred, are you there? Okay, my own response to, well, maybe Fred comes, Oriel's question is, the quick 10-second version is, we have to be careful about, when somebody says this is evidence view, evidence driven, you have to ask questions around, did that evidence actually, was it explicit about the types of contexts and support structures that are needed? That's one. Two is, too much of evaluation happens after the program planning stage. How do we actually bring in a more evaluative thinking right up front? Fred, are you there? Okay, let me, Fred, I cannot hear you. Sorry, somebody's speaking there. Fred, okay. Jerry, any quick reactions or questions?
Well, thank you very much. I think this is an extremely interesting session, not necessarily something we are always thinking about in our large organizations. I do think some of the points that are being made here about being humble, knowing, that what we can do is so much depending on context, on all those various factors, and taking this into account when we evaluate, and not have the linear, we do this, so that happens. I think that is extremely important also for an organization like ours. So maybe a question for you, and I think Sanjeev, you're also working in a larger organization now. What do you suggest now to, what would be some of your suggestions for an organization like the Pan American Health Organization, like World Health Organization, to take issues like this into account?
My simple answer within BMG, within the Bill and Melinda Gates Foundation, in the work that we are doing going forward, is to move away from super large evaluations that we become too product driven. We have to build in learning processes that have networks of different thinkers. Different organizations approach problems of evaluation differently. Almost all of them are not terribly sophisticated and understanding of the inequity space. So my simple answer is, think in terms of networks, think in terms of learning processes. To echo Abhijit's point, take learning seriously. Do not take don't define it purely in terms of evaluation products. You're missing that boat altogether. Build in those connections. Abhijit, quick reactions to Jerry's question, a really important question.
Well, I think you've said it, and I've tried to relate to that point in what I said. So there's nothing more to add.
Lovely. Mel, do you want to add anything here?
No, I'll pass. Thank you.
Andres, anything from your side?
I think, thank you very much. This has been a very interesting and stimulating presentation and discussion. I think what I think that for these tools and approaches to be institutionalized, you really need a shift in organizational thinking and structure. I think you were alluding to that, and that doesn't happen overnight. Especially if you are doing evaluations to identify basically progress towards the goal. I think that this nature of really looking for the maturity of a system that can help adapt the evaluation needs to be something that the institutions, both the donor institutions as well as the implementing institutions, need to thrive towards. So I think what we're talking about here is more than that. Is something that is really talking about highlighting the benefits on the long term of taking this approach, because of the short term, I think it will be quite difficult. And I like very much this Indian flag color slide that talks about what you want to break the relationship, you want to, yeah. And I think those are very important elements that have to be really taken into consideration. So I think with the question of Harry, yeah, what we need to really review and think how can this the way be operationalized, or at least some of these elements, maybe not everything, but some of these elements, and start showing or continue showing by practicing and doing. And once you do that, you are able to identify some of the benefits of putting this approach in place.
Andres, it's an excellent point. Organizations like PAHO, like the Bill and Melinda Gates Foundation, have to not just highlight cool evaluations that outside organizations have done. They have to demonstrate leadership on how evaluative thinking has changed some of the thinking on their part. That also means more dialogues between, more one-on-one dialogues between PAHO and BMGF and other organizations on that level itself. My third comment is we outsource too much of our thinking to our external organizations when we really need to take control. I see Antia wanting, Mel, go ahead, quick point, please.
Just going to say, with respect to an organization trying to change in this direction, it clearly doesn't have to be overnight or in exclusion of ongoing efforts to assess movement towards goals. It can be in addition, and perhaps in smaller kinds of proof of concept projects. And in that regard, nothing succeeds like success.
I'll go to Antia first and then Reggie and Rizande. Antia.
Hi, Sanjay. Thank you. Thank you so much for everyone's presentations. I have a question talking about context. One of the things that I was asking myself when I was listening to your presentations is how do you think political competition and the political cycle affects evaluation? Because I guess, politicians will never be very keen on acknowledging that they have failed. And this really goes against the nature of politics. And, but public policy is made by administrations that are led by, eventually, finally by governments and politicians. So it's a broad question, but I would be interested in hearing about your experiences and how is this affected by the broader, political and party context in democracies.
Let me take two questions. Reggie and Rizande, would you be able to frame your questions? Oriel, or can you, Reggie? Any questions from your side? Oriel, are there other questions in the chat that my language skills, are there other questions that need to be highlighted in the chat that you want to raise? Oriel?
See, Sanjeev, have another question in the question and response that you have in the link. You have some questions.
Can you raise it for me? Maybe I'm not, which ones are there? Can you highlight it, Oriel?
I can read it to you, Sanjeev. It says, what role do you see to qualitative methods and approaches in a health equity-oriented evaluation, especially developmental evaluations? A question by Oscar Mujica.
Okay, let's take any other question that needs to be addressed. So we've got a question on political cycle, a question on qualitative methods, any other question that needs to be urgently addressed. Okay, Mel, why don't you go first?
Oscar, I have another question.
Go ahead, Oriel, go for it. Please. Go ahead.
No, there's some question from Oscar that you put in the.
Yeah, that's the one I just read. So I think we covered it.
Mel, 30 seconds on political cycles or the other question, qualitative methods. Take your pick.
I'll take the easier question, which is qualitative and quantitative. Yes, Oscar, I think this will be addressed in greater detail in subsequent sessions. My view is that one needs to be Catholic, small c, with respect to methods, especially when you're trying to do learning. Sometimes the on the ground, in-depth understanding is critical, but one's likely to be multiple in those methods where possible. That's not a kind of a directive answer, but both have their place.
Abhijit, you got to handle a tougher one.
I'll take the political cycle because I do play in the political space.
Right.
And I think there is an assumption that political, the policy things moves ahead. But as we know, in a country like Brazil or in a country like India, there are huge pushbacks to what we could call the liberal agenda often. However, having said that, the policy space exists in us sort of, again, where multiple players are playing. Number one, there is the international context, let's say the SDG, which is moving in a particular direction, which all of us who are sitting here see as the desirable direction. But when I'm sitting in India and I'm looking at the political space, probably it's moving in a slightly undesirable direction. Sanjeev is sitting in a BMGF space. BMGF moves it in a particular direction. Then there is Indian bureaucracy, which is not the politician, but the technocracy. The question is, in order to deal with, let us say, a pushback from, let's say, the political cycle, how do the other actors act in collusion of interest? Until and unless there is a collusion of interest among certain actors in a certain direction, which is the advocacy part. If I am, let us say, an actor, let us say in the WHO, who wants to move it in the SDG side, I have to say, who are my allies in that space? And how do I create a mechanism which can subvert the political pressure, which will push it into the conservative space? So it is a political game. We cannot play it only technically. The moment we talk about the political space, the policy space, it is a contested space. So we are all advocates who understand technology, who understand techniques, who understand sectoral better, but we are political players. So we have to acknowledge that. I think each of us needs to acknowledge our own positionality. That's why I started my presentation as I'm interested in equity, both as a man, as a doctor, as a gynecologist. So until and unless I acknowledge those, my actions will not be honest.
Thanks, Abhijit. I'm super keen to 1 o'clock should mean 1 o'clock. So my own take very quickly for Antia's very tough question is, we need to move away from pure evaluations towards a learning function. In some of the funding options I want to make in the future, I want to have a learning partner that may be a little bit more protected. And we are not just giving a thumbs up or thumbs down view that can in some way, then I think we tend to get focused too much on the evaluations and evaluation reports. So that learning partner might be big. My comment on the qualitative one is, that's a good start, but you actually need far more than qualitative or quantitative. Again, that implies somehow wisdom lies in the method. I disagree strongly. Wisdom lies, to echo Abhijit's, in building relationships and dialogue. Today was a dialogue. That was really what made today useful, was a dialogue, not a cool new method you learned, not at all. And so I think that's important, because too much of our work really is waiting around for the report that's somehow going to show the way. That rarely happens. And I think we don't actually build those kinds of dialogue. From my side, I want to, before I turn it to Oriel and Jerry to wrap it up, warm thanks to Abhijit and Mel to really contribute in different ways. And you can see really the start of a very kind of important conversation happening. The critical promise to you for the next session in 3 weeks from now, I think it's November 18, is these are big ideas. Today, big ideas, we could paint anything on the canvas. On the canvas for November 18th is how do we do it? Show us examples. So grand ideas will have to take the back seat. Ways forward in almost mechanical ways. We'll reify the mechanical and we'll verify small steps, but they'll actually show a way. So we're sort of designing that stuff. Over to you, to Oriel and Jerry, to wrap it up.
Oriel, please go ahead. This you have really been the leader in this. Thank you.
Bueno, gracias. Voy a hablar, I speak in Spanish. Gracias, Sanjeev. Muchas gracias a Mel y Abhijit por este primer seminario que nos invita, ¿cierto? Y nos seduce a los próximos seminarios, ¿no? Y al trabajo en este tema. Hay algunas preguntas, ¿cierto?, que quedaron pendientes que precisamente vamos a ver en más detalle en las próximas sesiones, ¿no? Sobre todo en la aplicación de métodos, teoría concreta, y por otro lado ver, digamos, algunos ejemplos del uso de la evaluación en las decisiones, ¿no? Recuerdo procesos que se desarrollaron en mi país, en Chile, con respecto al uso de la evaluación. No solo para ver los resultados del programa, sino un aprendizaje de aquellos que eran parte de esos programas para hacer los cambios en el programa, ¿no? Y relevar la importancia de aquellos que están vinculados al quehacer directo de las actividades, las intervenciones, ser parte de las evaluaciones, ¿no? En el sentido que los aprendizajes son parte de las acciones que ellos mismos tienen que realizar, ellas mismas tienen que cambiar, ¿no? Y a veces esta mirada de que la evaluación es algo externo limita el involucramiento y genera resistencia, ¿no?, de los equipos con respecto a los cambios. Sobre todo cuando vemos que la evaluación tiene como un foco central, como hemos dicho en este caso, los temas de abordar la equidad, ¿no? El poder hacer las cosas diferentes. Y por lo tanto plantearnos de una forma de trabajo diferente para poder responder. Así que yo más que nada dar las gracias a todos y todas, invitarlos al próximo seminario, que es el 18, ¿cierto?, de noviembre, que va a ser un día jueves a la misma hora de acá, así que todos están invitados en esta invitación a seducirlos a ser parte de estas redes de evaluación realista y teniendo al centro la equidad. Gracias.
Thank you.
Thank you so much. Jerry, do you want to have a last word?
Thank you. That's all.
All right. Cheers. All right. Thanks again. Oriel, thanks a lot. Jerry, thanks to you. Thanks, Andres. Mel and Abhijit, thanks again. See you soon, probably in 3 weeks from now. Cheers. Bye-bye. Bye-bye. Bye, Gonzalo.